Welcome to the Motivational Interviewing for Home Health Professionals Part 1 conference call. My name is Jenny and I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the question-and-answer session, if you have a question, please press star then 1 on your touch-tone phone. I will now turn the call over to Ashley Green. You may begin.
Thank you so much, Jenny, and good afternoon, everyone. This is Ashley Green with Metastar in Madison, Wisconsin, one of the three quality improvement organizations, including Stratus in Minnesota and Impro in Michigan, who make up the Lake Superior Quality Innovation Network. It's my pleasure to welcome all of you and to introduce you to our speaker here in just a moment. As Jenny mentioned, we'll have Q&A available towards the end of the call, but along the way, Mia and I like to encourage folks to use the chat box. We'll monitor that as well. So if you had interesting comments or questions along the way, we certainly welcome those. Again, nice to have you on our two-part webinar series today. This first webinar offers a brief overview of the evidence base for motivational interviewing and the foundational spirit of this approach. And then on October 24th, webinar number 2, which completes the series, will introduce the core skill of reflective listening and explore an MI strategy for sharing information in a way that promotes patient engagement. And of course, we highly recommend that all of you attend each of the webinars, and Mia will talk about some additional activities in between the webinars as well. So Mia Croyle, our speaker today, has extensive experience. It's been a real joy to work with Mia. In fact, over the last couple of years, we've done a number of motivational interviewing workshops around Wisconsin. She's going to be doing some in Minnesota as well. She's a member of the Motivational Interviewing Network of Trainers, or MINT, and has facilitated, as I mentioned, a number of workshops for diverse groups of professionals across the country. She's trained as a clinical mental health counselor and has used MI in primary care and behavioral health contexts, as well as in telephone coaching for patients and families facing significant medical issues. Having experienced the enhancement in her own ability to partner with people and promote complex behavior changes while using MI, Mia enjoys sharing the approach with others and has trained professionals in healthcare, social service, early childhood, and criminal justice settings. Mia has a master's in clinical mental health counseling from Valparaiso University and is currently the expert training program manager with the UW School of Medicine and Public Health, Department of Family Medicine and Community Health. And with that, it is my pleasure to welcome Mia. Take it away.
Thanks, Ashley. And like Ashley said, I've had the pleasure to work with Metastar in doing some training in motivational interviewing across, various projects with various groups of professionals over the past several years. And I'm excited to be sharing a little bit about MI with you all today. So Ashley briefly let us know about the objectives, but, for both today and our webinar to come, part 2, we hope to get you a little bit familiar with the spirit of MI and help you think about how it compares and contrasts with some other approaches toward communicating with people about behaviors and potential changes. We'll help you think about how you might want to integrate one of the core MI skills, which is reflective listening. We're going to do some skills practice and learning around that, and how you might want to integrate that into your current way of communicating with people. And we're also going to share with you on the webinar, through both webinars, some MI strategies so that hopefully there's at least one that you think, hey, this is one I want to try out. I want to work this into how I normally do things. And then also, I'd like to help you think through some potential next steps for continuing your journey in motivational interviewing. I think it's important to share up front. I'm going to, I've crafted some content that I think will get you toward a little more understanding of what motivational interviewing is, what some of the key frameworks that it operates under are, and what some of the skills are. This is definitely not enough time, even over the course of 2 webinars, to really get you proficient and fluent in motivational interviewing. So if this is something that resonates with you, if this is something that appeals to you, we'll talk about some ways that you can continue to learn more and continue to move along toward a path of real fluency and proficiency in motivational interviewing. So for today, we're going to talk a little bit about the background and evidence base of motivational interviewing. We're going to talk about its worldview and just general approach, and then the spirit or style of MI, and we're going to work together. I'm going to demonstrate a little bit of a partnership activity that then you will have the opportunity to try out between our webinar calls, and I'll be interested to hear from you on the next call how it went and what your experience was in trying to put that into practice if it's something you choose to try to give a go. So we need to start before we move through our content and motivational interviewing. We really need to start by getting a little bit of a common understanding just of what motivational interviewing is and what that approach is like. Some of you may already be familiar with motivational interviewing. You may have learned about it in school. If you're a more recent graduate, you may have attended workshops or learning opportunities in the past. And some of you, this may be the first time you're ever hearing about this thing called motivational interviewing and you're not quite sure what it is. So one definition, there are several out there, but one definition of motivational interviewing is that it's a collaborative, person-centered guiding method, and it's specifically designed to elicit and strengthen motivation for change. So it is a communication style. It's also a set of communication techniques. So encompassed in motivational interviewing, there's sort of an approach and a worldview and a way of being, and then there's also a specific set of skills and strategies. And you can just learn the skills and strategies. You can just learn the spirit of the style, but it's not really motivational interviewing until you're combining all of those things together. I often say that motivational interviewing is somewhat misnamed in that I'm not sure that the name quite conjures up the image of what it really is. For me, when I hear motivational, the thing that first pops into my mind is like a motivational speaker. And that's someone who is going to, sort of inspire me through their story, or they're going to say things that convince me to do things or not do things differently or more or less, etc. And when I hear interviewing, I really think about this dynamic of someone asking me a lot of questions and gathering a lot of information about me that they've predetermined they want to know. Now, motivational interviewing certainly can help us uncover a lot of information about the people we're working with, but our main objective when we're utilizing motivational interviewing is not to collect or gather information. Our main objective is to have a conversation with the other person. And so I think, it's a little bit misnamed, or its name is maybe a little bit misleading. But it is what it is at this point, so I just think it's important to share with you a more full definition of what it is. So it really is designed to be something that we're doing together with another person. Motivational interviewing, we say that it's something we do with people, not to them. And it really is person-centered, which means our main focus is not on my agenda as the practitioner. It's not on, what I want to talk about, what I want to see happen. It's really focused on the other person and learning about their perspective and their wishes and desires. We say it's a guiding method because although it's person-centered and we focus a lot on the other person, we are also still trying to be in control somewhat of the conversation and the direction of it, and to guide people through that conversation in a productive way. And it's specifically designed when we're talking about motivation, particularly when we're talking about a behavior change. And what we try to do is elicit or draw out and strengthen that other person's already existing intrinsic motivation for change. So unlike a motivational speaker, I'm not trying to inspire someone to change by telling them my life story. I'm not trying to persuade them to change by being dynamic and compelling. I am trying to uncover the things that already exist within that other person that might motivate them to make that particular change. And when I'm talking about change, that really is a big net. So lots of things could fall under this idea of change or behavior change. It may be something very cut and dry, like quitting smoking, right? That's a very distinct and discrete behavior change. It may be something that involves a lot more individual tasks, like doing a better job of managing your diabetes. Right? That consists of lots of different small behaviors in there that all together will move someone toward better management of diabetes. It may be something like remaining safe and intact in their home for as long as possible. And again, that requires a whole host of different behaviors. And so when we look at that, we want to kind of drill down and think about what are the sub-behaviors in that big umbrella. So it may be taking medication as prescribed. It may be utilizing social service resources. It may be staying connected to family and other social supports and having that social interaction. It may be eating healthy nutrition. It may be making modifications to the home environment so that the risk of falls at home are minimized. So there's all of these small individual behaviors that might all fall under that big umbrella of the change that we want to see the person more motivated to make, being, to remain safe in their home and manage their health in the home setting for as long as possible. Another sort of more simplistic definition of what motivational interviewing is, this is sort of my elevator speech about what it is if someone asks what is this thing you do a lot of training on. Motivational interviewing is just a way of structuring our conversations where we help the other person talk themselves into making positive changes. So I'm not there to try and talk them into it. I'm not there to try and provide the reasons why someone should change. I'm there to help them figure out their own reasons. One of the things that I appreciate most about motivational interviewing is it really does give me a framework and a bit of a roadmap for having these conversations. So when I'm doing motivational interviewing, there are some things that I'm trying to always keep in mind as sort of my goals. First and foremost, I'm always trying to engage or connect with the other person. I always want, as much as possible, to establish a positive working relationship with that person. And what that takes is connection on a very basic human level with them. Now, that doesn't necessarily require that I just come in and do a bunch of chit-chatting with people. Some people do require a little bit of chatting to warm up, but it's really about the work we're doing, helping us get to the heart of the issue more quickly and connecting with others in a meaningful way. Also, within MI, one of the goals that I have when I'm doing MI with someone is to reduce resistance. And resistance may come up in a variety of different ways. It may be that, someone is resistant to the idea of even having a conversation with someone. So they may be bringing some baggage to our conversation and our interaction just based on past interactions they've had with other health professionals, based on expectations they have, fears they have. So they may come in with already set up to be pretty defended in that conversation. Or
Mia,
yep.
I'm sorry to interrupt you. I'm getting some chatter that the slides are not advancing. I was trying to figure that out on this end, but perhaps Emily from WebEx, if you're on, you can help us with that. Sorry about that, folks.
Oh, yeah. Thanks. It does look, Emily, like the ball is still with you and not with me. Emily, are you there? Is Emily from WebEx there, please? So it looks like they're seeing they're seeing the closed captioning, and they're seeing the intro slide. And I've been advancing them here on my screen, but I see now that they're probably not advancing on yours. And that's a WebEx. Ashley, I don't know if you have any other way to contact. Here, let me see if I can message the WebEx host.
You know, I'll do that. Why don't you continue to talk, Mia? Apologies to everyone. I'll see if I can sort of work through a back channel. I'm not sure quite what happened here, but it looks like WebEx dropped the ball, so to speak. So keep going, Mia, as best you can, and I'll see what I can find for us.
Okay. All right. Are you all seeing the slides advancing now?
Yeah, looks good, Mia.
Okay. So we have the objectives. We have the agenda for today's webinar. Here's our definition. Here's the shorter definition. And then here's where we were. So we were on that second bullet of talking about reducing resistance. People show up with some resistance or defensiveness for a variety of different reasons. And one of the reasons might be just because of past experiences or their expectations for the conversation, or it may be that things we do, we know from the research that there are things we can do in our communication with other people that raise up that resistance, that invite people to feel more defensive. One of the main things is any sort of judgment, or if people feel as though we are trying to persuade them to do something that they themselves are not ready to do or do not want to do, that invites people to feel resistant. I also think it's interesting if you think about that process on from more of a neuroscience point of view. You may have heard that, we sort of all have this very least evolved part of ourselves that is, called our fight or flight reflex. It's really often fight, flight, or freeze, right? So that part, that reflex in us gets triggered when we feel threatened. And I heard recently, and I've seen some research that shows that as human beings, we perceive judgment as a threat. So if I'm working with someone and I feel like they think I'm not very smart, or they think I've been making bad choices, or they, don't agree with the decisions I've been making, that on sort of a subconscious level is going to trigger that part of my nervous system that responds to threats. That's going to trigger that fight, flight, or freeze reflex in me. And for some people, depending on, a whole lot of other things, how we manage that fight, flight, or freeze reflex looks different. But you may see people getting kind of ornery with you when they feel triggered in that way. Or sometimes we see, particularly, this is somewhat a Midwest phenomenon, not completely, but we see that when people feel threatened in some way, when that reflex gets triggered, they start doing this, I call it roll over, agree, and then go home and do whatever you're going to do. So you get all that, oh, yes, that's a great idea. I'll absolutely do that. And then you come back for a follow-up visit and none of that has been done. So we get that acquiescence where people are really wanting to just please us in the moment because they feel like that's the most important thing for their safety. And then it doesn't really stick in any significant way. It doesn't ever translate into any sustained change on their part. So we want to really avoid triggering them in those ways, and that's one of the ways that we reduce resistance. And then the other thing is that motivational interviewing, as we get more proficient in the skills, it has some particular skills and responses built in that can really help us deal with some of the resistance that's just going to show up. No matter what we do, even though we're doing everything we can to avoid triggering that resistance, sometimes people's past experiences with people in roles like ours or in situations like they're in, working with people like us, will all continue to engender that resistance, even though we're doing everything right, so to speak. So the third bullet on that slide talks about the third practitioner goal in MI, which is to raise discrepancy. Now that feels a little bit, it's a bit of a counterpoint to the reduced resistance piece, because discrepancy talks about the distance between the way things are for someone and the way they'd like them to be. In that space, there's a lot of discomfort for people. If I asked you about something that you have, that you're working on, that you're trying to change or think you should change in your life, and then I asked you to sort of picture exactly how things are now, and then I asked you to picture how ideally things would be, right? So like, for me, it might be eating less fast food, right? So I think about, let me go through the past week and take inventory of how many times the kids and I have hit up the drive-through. And then I think about, okay, in an ideal world, how often would that be? And I picture what that would look like. And then I think about the difference, right? So that difference is the discrepancy. And so that's uncomfortable. And that discomfort is what leads people to change, right? In that discomfort is the motivation for change for people, because that aspirational goal of how I hope things will be, and some of that yuck feeling about how things are right now and how far away we are from that aspirational goal, that's the stuff where motivation lives. So we have to sort of raise some of that stuff up to a conscious level for people, and we have to try and hold the space in a way that it's safe enough for them to explore that, because that's really where they're going to find their motivation for change. And then the fourth bullet on that practitioner goals in MI is elicit change talk. And change talk in motivational interviewing is a very important concept. We won't have time to really get into the depth of it, but basically, briefly defined, it is anything the other person says that could be considered an argument for change. So anything they say about how they'd like things to be, how much they dislike the way things are, reasons why, ways they could, hopes they have about positive changes, that all counts as change talk. And one of our main goals in motivational interviewing is to get as much change talk out of the other person as possible, because we know from the research that it's very powerful, and we know that it really leads to behavior change. Hearing more change talk and hearing more advanced levels of change talk as we progress is one of the most important, most significant precursors to actual change in the world. So we want to hear more of it, and we want to do some specific things in motivational interviewing to draw more of it out. So I'm just going to very briefly go over a little bit of the research in motivational interviewing, and really, again, just so that we are all coming from a common understanding of what motivational interviewing is and why it is an important thing to consider incorporating into your work with the people you serve. So this slide, it looks like a very complicated graph slide, which as someone who's not super into numbers and graphs and charts, that's a little off-putting to me, but it really does a nice job of helping us visualize what the research tells us. So if you look at that very first bar graph right here, all the way to the left of the slide where it says 1988 to 94, that shows us the first 6 research studies in motivational interviewing. So the number is 6, and you'll notice that whole little bar is red. So that tells us, if we look over at the key on the far right-hand side of the slide, that tells us that those first 6 studies were all done in the field of alcohol and other drug treatment. So then if we hop over to that next bar here, let's see, I'm seeing if I can actually use the pointer. I don't know if I can. If we hop over here, we see that then that in that next time period, 95 to 99, we start to see, number one, the bar gets higher, so we've got more studies being published looking at the effectiveness of motivational interviewing, and they're in a number of different areas as well. So not just alcohol and drug treatment, but I think we go all the way up to family. So that whole first bottom portion of the list. So we've got treatment adherence and retention, tobacco and smoking cessation, HIV, STD risk, cardiac issues, diabetes, health promotion in general, family issues, right? So we see the research starting to spread to lots of different fields. And it continues as we look at the different bars. So, then the next field, we get a few new fields and a number more of studies. And this particular graph ends at 2009, so it's a little bit out of date now, but if we had the next bar, we would see that we now have well over 200 studies published, all looking at, all exploring the effectiveness of motivational interviewing, and we would see that there's just more and more fields of study being explored. So, yay, a bunch of research has been done. I know that's important to some people, but I kind of like the bottom line a little more. So what do we know? Some research has been done. What can we say with pretty good confidence based on over 200 studies looking at motivational interviewing? We know that MI improves retention, so how long someone stays in a program, adherence, how closely they follow a program, and outcomes across a wide range of behaviors and settings and contexts. We also know that motivational interviewing generalizes fairly well across cultures. It's been translated into many different languages. It's been studied not just in the U.S., not just in sort of white or European cultures. It's a worldwide thing. The group of MI trainers that I'm a member of has MI trainers and researchers represented from every continent and over 40 languages. So it really is something that is being spread across many cultures and being found to be effective as well. We also know from the research, and this is not unique to motivational interviewing, but we know that the relationship matters. And that's true whether we're talking about the relationship that happens in a 15-minute, one-time only encounter, or I guess I should say and, in any sort of long-term, sustained type of relationship. So relationship matters in how well you, as the professional, are able to engage and connect with that other person in the time that you have with them is going to impact their outcomes. And we also know that change talk, which we talked about briefly already, the other person's arguments for change, and then also sustained talk, which is the flip side of that, the other person's arguments for not changing, as well as discord, so that's a disruption in our relationship. We know that those three things all really matter and they all really impact outcomes. And we also know that they are in our control. There are some very reliable things that we can do to give us more change talk and less sustained talk. There are some very reliable things that we can do to give us less change talk and more sustained talk. And there are some very reliable things that we can do that stir up discord in our relationship with the other person. So there are things that we know we should be doing. There are things we know we shouldn't be doing, and we know this all from the research in MI. We also know that MI is learnable, which is good news for people like you who are here on a webinar hoping to learn it, and people like me who spend a lot of my time helping people explore it and think about ways to learn it. And we also know that proficiency, how well you do in MI, is reliably measurable. We have tools that look at that, and they very reliably can tell us, yes, this person is doing well at MI, or no, this person is not doing well at MI. And we also know that higher levels of proficiency predicts better outcomes for our patients or our clients or those we serve. So in some ways that is a very empowering thing. It's also gives me a little bit of pause sometimes because it's like, wow, it really is on my plate to do these things that the research tells us if I work at this and I do well at this, the people I am trying to help will do better on their goals. So bottom lining it for you, does it work? There was a meta-analysis done in 2010 that looked at across a whole host of MI studies, and they found that in 75% of the studies, the people who were taking part in MI interventions made improvements. Now, about 50% of those improvements were what we would call sort of modest improvements, but they were still statistically significant. They were still positive changes. And about 25% of that were really significant, substantial improvements. So I like to make that clear up front. MI is an evidence-based practice. We know that for a broad majority of clients and patients, MI is a helpful tool in your toolbox. And it's not a magic wand. So it's not necessarily going to be the thing that you just can go, oh, let me wave my MI wand on people, and all of a sudden everybody's cooperative and everybody wants to make all these positive changes and everybody's succeeding at them. So I think it's important to have our expectations be realistic, but it's also true that MI can be very transformative for people who really make a commitment to utilizing this approach. It can change both your experience of working with other people, and it can definitely change other people's experience of making changes and of working with you. So I'm going to talk a little bit about the approach and sort of maybe the worldview of motivational interviewing. And again, the purpose of all of this is to kind of get us to a point of a brief common understanding of what MI is and how it works. So a lot of helping professions use what's called a deficit approach. So this means that they really look at identifying the problem. What's the matter? Why is this person not making the changes that have been prescribed or recommended to them? Maybe they don't know, maybe they don't understand, perhaps They don't know how to make those changes. Maybe they just don't care. And sometimes maybe people are in denial. Okay? And so when we view the issue of change and people who struggle with change through that lens, we then make some assumptions about our role. So our role as the helper in that approach is to educate people, to inform people, maybe to persuade them, and definitely to provide for them and to them, to give them what's missing. So the metaphor there is, if the person we're working with is a cup and, it's not full to the top, we're focusing on what's empty, and we're working then on, metaphorically, sort of filling them up. Let me be the faucet, and let me pour what I think is missing into your cup. And I don't know about you, but I have certainly been in situations where I feel like I am pouring and pouring and pouring, and gosh darn it, there must be a hole somewhere in this cup, because no matter how much I pour into this person or this situation, they're still not making the changes. They're still not being successful. It's just not happening. And that can get really frustrating. And it can be then a self-fulfilling prophecy, right? So if I tell myself they don't care, and then I work really hard to persuade them that they should care, and then they're still not making the changes, I can then fall back on, well, they just don't care, and wash my hands of the situation, absolve myself of any responsibility, and walk away, right? Versus when we approach these same challenges from a competence approach, instead of focusing on what's empty, we're really training our eye to focus on what's there. The cup still isn't full to the top, still isn't overflowing, but we're going to focus on what is there. And so we might ask questions like, what matters to this person? What are their strengths? What are their values? What are their guiding principles? What resources might they have? What have been their past experiences? What's their perspective on this issue? And so then, again, that tells me a little bit about what my role is. So my role is to listen, to try to understand, to be reflecting back themes that I'm noticing, connections, pieces of the puzzle that might fit together in new ways, and to be asking some stimulating questions that help them think about where they might want to go from there and how they might want to do it. So it really tells us then, with our same metaphor, right? They're a cup. They're certainly not full all the way, but instead of trying to fill up that empty space, I'm trying to draw up whatever water might be there or whatever liquid might be in the cup. I'm then going to try and be the straw that draws that up and applies it to the situation at hand. Whatever competence, values, and resources are already there. So our worldview then in MI is that people are competent. Now, that's not a mental status declaration, and that doesn't mean that they couldn't be supplemented with some other resources around them, but at their core, people are competent, and that they have some things, some knowledge about themselves, attitudes, and capabilities that can be positive components of a change. And so our main focus when we're working in an MI way with people is on being present with them in a way that's going to be supportive of that change. And so we have four main sort of named components of the spirit of motivational interviewing: partnership, evocation, acceptance, and compassion. And the first one we're going to look at is partnership. So when we're trying to work with people in a partnering way, we don't just tell them what we're going to work on. We try to negotiate some agenda and some goals for our time together. We help them look at maybe menus of options. We explicitly say things that identify them as the expert. Things like, I know some stuff about how people can take care of their health, but really you're the expert on you, and you're going to be the one who knows best what's going to work in your life. So if we're going to be successful at this, I think we're going to have to put our expertise together, right? And then a person who's really working on this partnership often has to sort of hold back on advice giving and expertise to let that other person's expertise shine and take a bit of a leadership role. So we say as a metaphor for partnership that we want our encounters with people to feel more like dancing with someone than wrestling. So these are my personal pictures. Here's me dancing with my dad at the wedding, and he certainly had some ideas about how to lead our dance at the father-daughter dance at my wedding, and I certainly at times was willing to follow, but I also had some ideas about what I wanted that dance to be like and made sure, and so it was really, a true partnership. So sort of like if you think about some ballroom dancing, which we certainly weren't skillful enough to pull off, but some ballroom dancing where really both people have to show up and have to have some confidence, even though someone maybe is guiding where you go, both people are very fully present in that dance. And then this is my little son in the purple on top with wrestling. And when I think about wrestling, it's really a bit of a struggle for control, and you're trying to get the other person to submit to your wishes, that they lay down flat on their back and get pinned. And so you can think, I like to think of this as just kind of like a finger to the wind test about how I'm doing in partnership. It's like, what did the energy of our interaction feel more like? Did it feel more like we were dancing or more like we were wrestling? So the second element of our spirit of motivational interviewing is evocation. So that is just a fancy way of talking about drawing things out from the other person. And so we really want to show up with a curiosity about the other person, about their ideas and their perspective and their thoughts and feelings about whatever the issue we're discussing is. We're not relying on education or sharing information as our means to help them decide to change. So this is important, I think, particularly in healthcare, because we do a lot of education and we do a lot of information sharing, and this isn't to say that there's anything wrong with either of those activities. And I think often what we try to do in healthcare is use it as a crowbar to force people to want to make a change. We use our education and we use the information sharing almost in a persuasive way. So we're not teaching them how to do something that they've already decided that they want to do. We're using the teaching to try and convince them to want to do something. And so it's important to really think about our intentions and the timing of that educational piece and of our information sharing, because we want to prioritize the other person's own motivation for change over, what we think is most important, which is, what we know about, the potential risks, the potential benefits, or why they should do what we want them to do. So, with evocation, we want to think about drawing out and being a good listener as opposed to just sort of completing a checklist. And then our third element of the spirit of motivational interviewing is acceptance. And this talks about sort of two different components of that acceptance. One is really an acceptance of the other person's own autonomy, their own right to self-determination, and the idea that really what, if anything, they decide to do is up to them. And there may be consequences or outcomes from the decisions they make that we want to make sure they're aware of, and that there may be outcomes and consequences that we don't want to see for them. And they may choose to do things differently than we would. But ultimately, there is a piece of self-determination in there. And so that's a huge component of acceptance. And then the other main facet of our acceptance piece of the spirit of motivational interviewing is just talks about this unconditional positive regard. So this idea that we are going to love and accept people as they are unconditionally. We are going to value them and prize them just for their being, not because they're making the choices that we would make or the choices that we want them to make or they're doing things quote unquote right, but we're going to really value them no matter what. So this image is just, there used to be this gum, and I don't know if they still make it or not, but it was called Up to You gum. So this really is sort of our acceptance gum, right? Like, you've got some choices. It's okay, whichever choice you make, you decide. And then the last element of the spirit of motivational interviewing is compassion. And I can't say it better than the original architects of motivational interviewing, Bill Miller and Stephen Wolnick, who put this in their book. We developed MI for use by people like those in the helping professions whose primary focus is on the well-being of the client. It is never to be used with the intention of selling products or getting people to do something that benefits the provider, which we've explicitly described as unethical practice. A cornerstone of MI spirit is compassion, whereby the patient's well-being is our prime directive and the reason for our consultations. Dr. William Mayo, one of the founders of the Mayo Clinic, said it well in 1910, the best interest of the patient is the only interest to be considered. So that often, I think, goes without saying, but as we move into a world where even our health care is much more closely controlled for quality, much more closely incentivized for outcomes, we have to make sure that we are continuing to do what we do and the way we do it. So when we do MI, as well as everything else, we have to make sure that we're really keeping as our guiding North Star the best interest of the other person. So I'm going to very quickly go over an activity around partnership and give you an example of it. And then this is one of the things that between now and our next call, I'm hoping that you'll take the opportunity to try out with some of the people you work with and report back to the group at the beginning of our next call, how that went, what you found, and how it went for you. So we call this agenda setting or sometimes agenda mapping. Sometimes I most often refer to it as the bubble worksheet, but you'll see that why in a minute on that. And this is really an activity where we make this idea of partnership where we're going to share the agenda. We make it very explicit and transparent in our interactions. And it's also it can be a very grounding activity. And it includes potentially a visual aid, which can be very useful for some patients, especially patients who maybe are having some cognitive issues where, just talking about things might make focus a little bit challenging. And it's a very flexible activity. I've seen it adapted in hundreds of different ways, so I like to share it with people because I think it's one that if you think it might be useful, I can't imagine a way that you couldn't make it work for your setting. So this is one example, and here they call it a visual behavioral menu, but this would be for a conversation about pediatric obesity and the prevention of pediatric obesity. And so the way that this might be developed or utilized is, if I'm someone who's going to have conversations on a regular basis with parents and kids about maintaining a healthy weight, I might have this filled out and bring it to the beginning of the conversation and say, I've already filled in some of these circles, some of these bubbles with things that I commonly talk to people about when we're talking about maintaining a healthy weight, things like getting enough sleep, fruits and vegetables, physical activity, reduce, screen time, and sugar-sweetened beverages or just beverages in general. You'll notice that some of these circles are blank. And this is where I really want to hear from you. What are your important items that you want to make sure you get on our agenda? I would listen then to what they tell me, fill in the empty circles, and then perhaps even invite them, okay, we've got time maybe today to get to one or two of these. Where should we start? And let them have some say-so in how we spend our time. There's a few things in particular that I don't like about the way this particular one is set up. Number one, I don't like the ratio, right? So there's 1, 2, 3, 4, 5 things that are my agenda and 3 for the other person. So my suggestion is always have it half or more of the agenda items be for the other person. So ideally this would be, 4 and 4. Or I have 3 filled in and then leave 5 open for them and for their agenda items. The other thing I don't like is that all 5 of the things that are listed are already telling people what to do. So as a parent, if I look at this, I'm already feeling overwhelmed with these 5 things I have to do. I have to make sure my kids get enough sleep. I have to make sure they eat 5 servings of fruits and vegetables. So I would just, if I'm writing them on the sheet, I would put them as general. So instead of saying get enough sleep, I would just say sleep. Instead of eat 5 servings of fruit or vegetables, I would just say fruit and veggies. Instead of saying increase physical activity, I might just say physical activity. And then I can start each topic with an exploration of what they already do and where they're already at in that issue. So here's another example, and again, the ratio's all wrong in here. We've got a bunch and then 2 blank ones. But these are pretty general, so physical health, work, spiritual health. But still, this one would be really if you have a wide open thing and then a couple more, and then it's very important with one that would be filled out this much to definitely let the other person pick where you start, or maybe star the 3 that they want to get to that day or something like that. And then here's another one, same thing, still kind of the ratio's a little bit mixed up. And then here's one that I developed actually for some work that I was doing with some home visitor programs in a dementia prevention program. And this isn't the prettiest thing in the world, but they wanted to talk about diet and how were they getting enough healthy nutrition. They wanted to talk about social support, and so we had that over there. And what we decided to do was use images instead of words, which I think is a good adaptation of this tool, because it really can help people across a range of literacy and potential cognitive issues. So we had fall prevention and medication, right, as our 4, and we put those on the outside, and we wanted to center what the other person's ideas were. So for next time, you are going to be sent, I'm not sure if it'll come from official channels through Metastar or separately.
It will.
Okay, so it'll come from Metastar. You will be sent a worksheet that has some introspective exercises, so just some quiet things you can do individually, some sort of thinking to do, and then a partnership activity. And so, which is the one we just looked at the examples of. So it'll have a blank bubble sheet. Feel free to make your own blank one, however you see fit, but there is a blank one template for you to use if you so choose. And so try to find some time between now and the next conference call, the next webinar, to partner with a coworker to kind of plan out how you might introduce it, or plan it out on your own, and give it a try with at least one person you work with, right? Like, so how might you frame up that goal-setting conversation? You can use any number of bubbles in any array on the page that you want. So if it's a short conversation, you might choose to have 2 or 3 bubbles. If it's the beginning conversation to plan a year's worth potentially of work with someone, you might have a bunch of bubbles. You can make that work for you in whatever way you want. But for next time, try and give those 2 things a go, and we'll be starting our next webinar with a debrief on both the introspective worksheet and that partnership activity. So plan to come ready to talk and share your experiences on the next call. So at this point, we're going to open it up for any questions. I know we don't have a lot of time, but you should also see the evaluation questions popping up. But if there are any questions, feel free to, I think it's *1. If you have any questions or comments, You also have my email, so if there's anything you want me to be sure to cover in the next webinar, shoot me an email with a question or a comment.
Jenny, can you remind folks how to dial in for a question?
If you have a question, please press star then 1 on your touch-tone phone. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touch-tone phone.
All right, is that no questions then for the moment?
I guess so, and I don't see any in the chat box either. So please do feel free to use my email if you have questions or any particular comment or area you'd like me to be sure to cover in our next webinar.
All right, well, with that, we'll go ahead and end the call. Just want to thank everyone for their time today. And Mia, thanks as always to you. We will talk to everyone 2 weeks from today on the 24th, so we look forward to seeing you then. Thanks, everyone, and have a great day.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.